So let's discuss about the vessels of the pelvis in the second part of the pelvis lecture. Extremely important branches of the internal iliac artery. Enumeration question extremely important. The internal iliac artery is basically a smaller terminal branch of the common iliac artery, about 3.75 centimeter long, supplying the pelvic organs except those supplied by the superior rectal, ovarian, and the median sacral arteries, also supplies the perineal area, the greater part of the gluteal region, and the iliac fossa. In the fetus, the internal iliac artery is double the size of the external iliac artery because it is transmitting blood to the placenta through the umbilical artery. The umbilical artery, right, then forms a direct continuation of the common iliac artery. At birth, the proximal part of the umbilical artery persists to form the superior vesical artery over here, and the rest of it degenerates into a fibrous cord, that is the medial umbilical ligament. Okay. Now, course, the internal iliac artery here begins in front of the sacroiliac joint at the level of the intervertebral disc between the L5 lumbar vertebrae and the sacrum. Here it is lying medial to the psoas major muscle. Now, right. So this artery, it runs backwards, downwards, backwards, and ends near the upper margin of the greater sciatic foramen over here, dividing into an anterior division and a posterior division. Now, relations in the female. Here is the common iliac, this is the internal iliac artery. It is lying related to the ovary and the lateral end of the uterine tube and the ureter in front. We can see the ureter. Posteriorly related to the internal iliac vein, lumbosacral trunk, and the sacroiliac joint. Right. Laterally, we have the external iliac vessels, as you can see over here, and the obturator nerve. And medially, we have the peritoneum and few tributaries of the internal iliac vein. Important branches of the anterior division of the internal iliac artery in male, it is giving off 6 branches. The superior vesicle, okay, the obturator artery, here is the obturator artery, the superior vesicle, the middle rectal, you can see the middle rectal over here, the inferior vesical arteries over here running with the inferior part of the bladder, as the name suggests. Inferior gluteal, here is the inferior gluteal artery, and then we have the internal pudendal artery over here, right? And the inferior gluteal artery, this one, and the internal pudendal arteries are the terminal branches of anterior division of the internal iliac artery. Right. In the female, okay, it is giving off 7 branches. The inferior vesical artery gets replaced by the vaginal artery over here. You can see this is the vaginal artery. Okay. Instead of the inferior vesicle, we have the vaginal artery. And the uterine artery is the 7th branch. This is the uterine artery, you can see over here, coming from the anterior trunk of the internal iliac artery in the female. Now, these branches further on can be classified as parietal and the visceral. Okay, we'll come to that later on. Firstly, the divisions of the posterior part. It is giving off the iliolumbar artery. Can you see this is the iliolumbar artery? The 2 lateral sacral arteries, right? And the superior gluteal artery over here. This is the superior gluteal artery. Parietal branches of the anterior division. Anterior division, we have the parietal and the visceral. The parietal arteries are the inferior gluteal artery. It is the largest branch of the anterior division of the internal iliac artery. It is the axial artery of the lower limb, chiefly supplying the buttock and the back of the thigh. In the pelvis, it is running downwards. You can see in front of the sacral plexus and the piriformis muscle, the inferior gluteal artery. Next, it is piercing the parietal pelvic fascia, passes below the first sacral nerve and then between the piriformis and the coccygeus, entering the gluteal region through the lower part of the greater sciatic foramen. In the pelvis, it is giving muscular branches to nearby muscles and the vesical branch to the base of the bladder, the seminal vesicle, and the prostate. Number two is the obturator artery over here. You can see it's the obturator artery. It is running forward, downward onto the obturator fascia and above the obturator vein. Medially, it is crossed by the ureter. You can see it is crossed by the ureter and the ductus deferens as well. This is the ductus deferens. Okay. And it is covered with the peritoneum, the obturator artery running like this. Now, this obturator artery, having crossed the ureter as well as the ductus deferens, then passes through the obturator foramen to leave the pelvis and enter into the thigh. In the pelvis, it is giving off the iliac branches to the iliac fossa, the vesical branches to the urinary bladder, and then a pubic branch to the back of the pubis, which will anastomose with the pubic branch of the inferior epigastric artery and with its fellow of the opposite side. After doing the parietal branches, let's come to the visceral branches of the anterior division. The visceral branches that is going to the viscera. Firstly, we have the superior vesical artery, so the superior vesical artery. Proximal 2.5 centimeter or so, it represents the persistent part of the umbilical artery, supplying many branches to the upper part of the urinary bladder, and one of these branches gives off the artery to the ductus deferens as well. The middle rectal artery, this is the middle rectal artery going towards the rectum. Now, it has three important features. It is often absent in females. Very little of this blood goes to the rectum, and if at all it does go, it goes only to the muscular coat, right? And most of the blood goes to basically the prostate gland and the seminal vesicle over here. Then we have the inferior vesical artery. This is the inferior vesical artery going towards the base of the bladder, supplying the trigone of the bladder, the prostate gland, the seminal vesicle, and the lower part of the ureter as well. Then we have the internal pudendal artery. We can see this is the internal pudendal artery with a smaller terminal branch of the anterior division of the internal iliac artery, supplying the perineum and the external genitalia. The branches are inferior rectal, perineal, artery to the bulb, urethral, deep, and dorsal arteries. Then we have the vaginal artery, okay, corresponding to the inferior vesical artery of the male. This is the vaginal artery over here, right? Okay, supplying the vagina, vulva of the vestibule, base of the bladder, and adjacent part of the rectum, right? You can see the vaginal artery over here, right? Then sixth, we have the uterine artery. Here is the uterine artery supplying the uterus over here. It has a tortuous course, crosses the ureter, 2 centimeter lateral to the cervix, runs along the side of the uterus, supplying the vagina, cervix, uterus, and the fallopian tube. Now, branches of the posterior division, we did number 1 was the iliolumbar branch. This was the iliolumbar branch running upward in front of the sacroiliac joint and the lumbosacral trunk and behind the obturator nerve and the external iliac vessels. Behind the psoas major, it is dividing into the lumbar and the iliac branches. This is the lateral sacral artery over here, usually 2 in number, upper and lower, running downward and medially over the sacral nerves. Their branches enter into the 4 anterior sacral foramina, as you can see, to supply the contents of the sacral canal. Their termination pass out through the posterior sacral foramina and supply the muscles and the skin on the back of the sacrum. Right. Also, we have the superior gluteal artery over here running backward, piercing the pelvic fascia, passing above the first sacral nerve, leaving the pelvis to the greater sciatic foramen above the piriformis muscle. Now, the superior gluteal artery is supplying the gluteus maximus muscle, also participating in the anastomosis around the anterior superior iliac spine and in the trochanteric anastomosis to supply the nearby muscles and the overlying skin. Now, to summarize, branches of internal iliac artery has a posterior and anterior division, right? Let's talk about the anterior division first. Both of them, anterior and posterior division, have parietal and visceral, parietal and visceral. Coming to the anterior division first, the parietal ones are the ones at the lateral pelvic wall, that is the inferior gluteal and the obturator. Amongst the visceral, that is supplying the viscera or the organs, we have the superior vesicle, inferior vesicle in male. Then we have the middle rectal, internal pudendal. In females, we have the vaginal artery and the uterine artery. The posterior division, again parietal and visceral layer. The posterior division has no visceral branch, it only has parietal branch, namely the iliolumbar, lateral sacral, and the superior gluteal. Okay, right. So you can see this is the common iliac artery. This is the sacral promontory here, right? Then you can see the pelvic brim. This is the pelvic brim, and this is the lesser pelvis. Now, again, we have the anterior and the posterior trunk. Anterior trunk 8 branches, posterior trunk 3 branches. Right, firstly we have the umbilical artery that gets obliterated and part of it remains as the superior vesical artery. The proximal part gets converted into the median umbilical ligament and the rest into the superior vesical artery. You can see this. Next we have the obturator artery. As you can see, it will exit the pelvis. It is lying in the obturator canal, exiting the pelvis via the obturator foramen to enter the middle side of the thigh. Then we have the uterine artery, highly tortuous, only found in females. You can see it is going to run at the lateral wall of the pelvis of the uterus and it has a highly tortuous course. Next we have the inferior vesical artery. This may be absent in females or replaced by the vaginal artery. Here you can see the bladder over here. This is the urinary bladder. Right, you can see the inferior vesical artery supplying it over here. and the superior vesical artery supplying over here. Then we have the vaginal artery, only in the female, going towards the vagina. Next we have the middle rectal artery. Now it supplies, it may be absent, it is supplying this is the rectum, but if at all it supplies the muscular coat of the rectum, the middle rectal artery over here, basically supplying the seminal vesicle ejaculatory duct. Next we have the internal pudendal artery. It is supplying the perineum. This is the piriformis muscle, right? So beneath that, yes, from the greater sciatic, this is the sacrospinous ligament, sacrotuberous ligament, I'm sorry. So this is the greater sciatic foramen and this is the lesser sciatic foramen. The internal pudendal artery traverses the both to lie in the pudendal canal at the lateral wall of the pelvis and enter into the perineum to supply it. And this is the piriformis muscle. These are the branches of the internal pudendal artery. Anterior division. Now, the posterior division, this is the iliolumbar artery. Can you see? This is running upward at the ala of the sacrum and supplying the iliac fossa. This is the psoas major muscle. This is psoas major, this is the iliacus. It is supplying these muscles. Iliacus, quadratus lumborum, and psoas major. Then this is the lateral sacral artery. Right. Can you see the relation with the piriformis running? Yeah, so this is the superior gluteal artery. Superior gluteal artery supplying the gluteal region. Okay. So the branches are the internal pudendal, inferior vesical, inferior gluteal. So 3 eyes. The vaginal in female, uterine, superior vesical, umbilical, middle rectal, obturator, superior gluteal, iliolumbar, and the lateral sacral. Division of the anterior and the posterior trunk. Right, so these are the branches of the internal iliac artery supplying the organs in females. You can see into the uterine artery, highly tortuous, so the vaginal artery. These are your vesical arteries, superior and inferior, supplying the bladder. Then we have the middle rectal artery, right? Then we have the inferior gluteal artery. Sorry, the internal pudendals are going to the labium, the external genitalia. Right. Then coming to the venous drainage, we have the internal iliac vein that is ascending the posteromedially to the internal iliac artery, to the internal iliac, to the vein, and is joining the external iliac vein at the common to form the common iliac vein at the pelvic brim. In front of the lower part of the sacroiliac joint, its tributaries correspond with the branches of the artery except the ilolumbar vein which joins the common iliac vein. Now, the tributaries are as follows. Veins arising in and outside the lateral pelvic wall. That is the superior gluteal is the largest tributary. Then we have the inferior gluteal, internal pudendal, obturator, and the lateral sacral veins. Veins arising from the plexus of the pelvic viscera. We can see their plexuses over here. There's a rectal venous plexus drained by the superior, middle, and inferior rectal vein. Then we have the prostatic venous plexus drained by the vesical and the internal iliac veins. Right, the vesical plexus is drained by the vesical veins. We have the uterine venous plexus drained by the uterine veins, and the vaginal venous plexus drained by the vaginal veins. Coming to the lymph nodes of the pelvis. The pelvic lymphatics drain the following lymph nodes. Okay, number 1, 4 to 6 common iliac nodes. The common iliac nodes receive lymphatics from the external and the internal iliac nodes and send their efferents to the lateral aortic nodes. Then the internal iliac nodes over here receive lymphatics from all the pelvic viscera and the deeper parts of the perineum, the muscle of the back and that of the thigh. Their efferents pass to the common iliac nodes. The sacral and the obturator nodes are outlying members of the group. Then we have 8 to 10 external iliac nodes, not mentioned over here, from the inguinal nodes, the deeper layers of the infraumbilical part of the anterior abdominal wall, the membranous urethra, the prostate, the base of the urinary bladder, the uterine cervix, and the part of the vagina. Their efferents pass to the common iliac nodes over here, the inferior epigastric, and the circumflex iliac nodes are the outlying members of this group. Coming to the nerves of the pelvis, they include the lumbosacral plexus, okay, the coccygeal plexus, and then the pelvic autonomic nerves. Lumbosacral plexus. The lumbosacral plexus formed by the lumbosacral trunk, you can see over here, and the ventral rami of S1, S2, S3, S4 nerve. Lumbosacral trunk is formed by descending branch of the ventral ramus of nerves L4 and L5. This is formed a lumbosacral trunk along with these nerve roots. Now this trunk descends over the ala of the sacrum, crossing the pelvic brim in front of the sacroiliac joint and joins the nerve S1. Okay, over here. S1 and S2 are large and other sacral nerve becomes progressively smaller. Lumbosacral trunk and the ramus S1 are separated from each other by the superior gluteal vessels, both lying in front of the sacroiliac joint before passing onto the surface of the piriformis. Thus, both are involved in the pathological conditions of this joint. Now, the ramus S1 is separated from ramus S2 by the inferior gluteal vessels. Ramus S2 and S3 lie between the anterior surface of the piriformis and the pelvic fascia. The main plexus lies in front of the piriformis, deep to the pelvic fascia, behind the internal iliac vessels and the ureter. Right. So layout, connections and branches. Each ventral ramus receives gray ramus communicants from the sympathetic chain at the anterior sacral foramen. Right. sympathetic chain not seen over here. Now, before not uniting to form the plexus, the ventral rami gives off twigs to the piriformis and supplying it twigs to the levator ani, the coccygeus and the sphincter ani externus, and the pelvic splanchnic nerves. S2, 3, 4. The plexus gives rise to two main branches, namely the sciatic nerve and then the pudendal nerve, concerned respectively with locomotion and reproduction. As in other plexuses, the rami tend to divide into a ventral and a dorsal division supplying the corresponding spaces of the lower limb and trunk. In general, the dorsal divisions supply the extensors and the abductors, and the ventral division supplying the flexors and the adductors of the limb. Branches. Branches are derived from both the dorsal and the ventral divisions are as follows. Number one, we have the sciatic nerve. The common peroneal nerve component arises from dorsal division L4, 5, 6, 5, S1, 2. Now, this is supplying the everter of the foot and dorsiflexors of the ankle joint. The tibial component arises from ventral division of L4, L5, S1, S2, the tibial component, supplying the hamstring muscles and all muscles of the calf and intrinsic muscles of the sole. The posterior cutaneous nerve of the thigh, dorsal division of S1, S2, and ventral division of S2, S3. Branches of the dorsal division are the superior gluteal nerve, the inferior gluteal nerve, the nerve to piriformis, and perforating cutaneous nerves. Muscular branches, nerve to levator ani or iliococcygeus part of the coccygeus or ischiococcygeus arising from nerve S4 and enter the pelvic surfaces. The nerve to the middle part of the sphincter ani externus is called the perineal branch of the fourth sacral nerve. It is running forward on the coccygeus and reaches the ischioanal fossae by passing between the coccygeus and the levator ani. In addition to the lower end of the external sphincter, it is also supplying the skin between the anus and the coccyx. The muscular branches, nerves to levator ani. Okay. So coming to the coccygeal plexus, it is formed by the ventral division of spinal nerve S4, descending branch S5, and the coccygeal nerve. Okay, this is the coccygeal plexus. You can see S4, coccyx, and the coccyx 1 nerve. S4, S5, and coccyx first nerve. These three nerves join the pelvic surface of the coccyx to form a small plexus called the coccygeal plexus, giving off branches to the inner coccygeal nerve, which pierces the sacrotuberous ligament supplying the skin near the coccyx. Now, pelvic autonomic system, very important. The pelvic sympathetic system, you can see the sympathetic chain over here. So the pelvic part running downward, slightly medial over the sacrum, you can see over here, and then along the medial margin of the anterior sacral foramina. The two chains are uniting in front of the coccyx to form the small ganglion empire. The chain bears four sacral ganglia on each side and a single ganglion empire in the central part. The branches of these chain are the gray rami communicantis to all sacral and coccygeal ventral rami, branches to the inferior hypogastric plexus from the upper ganglia, branches to the median sacral artery from the lower ganglia, branches to the rectum from the lower ganglia, and branches to the glomus coccygeum from the ganglion empire. The inferior hypogastric plexus, this is the inferior hypogastric plexus, one on each side of the rectum, right? This is the inferior hypogastric plexus, and other pelvic viscera is formed by the corresponding hypogastric nerve from the superior hypogastric plexus, branches from the upper ganglia of the sacral sympathetic chain and the pelvic splanchnic nerves. So, the branches of the plexus are accompanying the visceral branches of the internal iliac artery, namely the rectal plexus, vesical plexus rectal along the rectum, vesical plexus from the bladder, prostatic plexus from the prostate, and then the uterovaginal plexus. Very important question: pelvic splanchnic nerves or the nervi irrigantis. They are representing the sacral outflow of the parasympathetic nervous system, arising as fine filaments from the ventral rami of S234, joining the inferior hypogastric plexus and are distributed to the pelvic organs. Now, some of these fibers ascend with the hypogastric nerve to the superior hypogastric plexus and then to the inferior mesenteric plexus. Others descend independently and directly to the part of the colon derived from the hindgut. Right? So that's all about the neurovasculature of the pelvis. Thank you.